this wonderful map here that I really do love. And I was so excited to find out that we have representatives not only from the United States, but from Canada as well. Thank you very much for being here. And because of that, Glenda and I wanted to make sure that you knew that this presentation includes information from both the United States and the Canadian side with their guidelines and their agencies. So it's looked at, our presentation is being looked at from both the Canadian and the US side, which is really fairly reflective of each other. I'm going to start out with statistics today on the COVID-19. There are many sites you can get statistics from to update yourself on numbers for COVID-19. This is the site that I use because of its graphics. It's a Google site, and I have the site listed on the slide. And it really prepares better graphics, I think, for presentation than the WHO or the CDC or the Department of Health. But you can go in any of those sites, including this one, and slice and dice the data the way you want to be able to pick out the information you need. So for Canada, this is as of yesterday's reporting on this site, you have a 7-day average of 4,200 cases of COVID-19. And I listed the top provinces there. Ontario is the top province for a number of total cases of COVID-19. After Saskatchewan, I am so sorry, my tongue twisted on that one, the numbers of cases lowered dramatically. So that's why I only listed the top 6. But you can go into the site and you can click on just Canada or any of the provinces and find out a lot of great information for yourself. For the United States, we have a little bit higher numbers, although both, I hope you notice, both in the Canadian graph and the United States graphs, we're seeing numbers coming down, and they're spiking every once in a while, but the numbers are actually coming down, and we're hoping that it stays that way. As of February 2nd's report, the United States 7-day average was 141,137 cases reported on a daily basis. And you'll also notice in the chart that it not only gives you the states or the provinces, but it gives you the country, and then it compares it to worldwide data as well. These are our top 5 states in the United States that are reporting total cases. California leads the way with over 3 million. Illinois is over 1 million. The rest of the states are below 1 million cases. So the neat thing is I had a whole paper that talked about the vaccines. So I'm going to be going off the top of my head here because I have no idea oh, there it is. Never mind, I have it. So the major topics that we're going to talk about here, the very first one is about the vaccine. The number of vaccines that are actually in clinical development is 64. There's 173 in pre-clinical development, meaning that they have not gotten as far along as the other vaccines. The primary vaccines in the United States, of course, are the Pfizer and the Moderna that we'll talk about in a second. But they are both messenger RNA vaccines, a very new technology, nothing like influenza vaccines. These vaccines are safe. They do not use a live virus, so it doesn't carry the risk of disease. It does, however, take a few weeks to develop immunity to the virus. And we still are at the beginning of the phases of using the vaccine, so it's too soon to know how long the vaccine protection will actually last. I was going to compare Pfizer and Moderna. Very easy to compare the two of them. These are the only 2 right now that are in the United States and Canada, although there's a couple new ones on the horizon that may be coming by the end of the summer. Pfizer is 95% effective. Moderna is 94.5% effective. Big differences between these two are, number one, Pfizer is a 2-shot and it's 30 micrograms given 21 days apart, whereas Moderna is 100 micrograms given 2 shots 28 days apart. The other difference is that the Pfizer has to be diluted. It's diluted with the use of sodium chloride, and it has to be diluted previous to, obviously, given to as the injection. Moderna doesn't require any type of dilution. And the big story for Pfizer, I know we've all heard stories about this, is that it has to be stored at less than 112 to less than 76, minus 76 degrees Fahrenheit. That is really low. Healthcare facilities were kind of taken off guard by this, and they really had to move fast if they were going to use the Pfizer and be able to have large enough freezers that go to minus 112 minus 76. And there's been a lot of stories about the use of that vaccine and keeping it frozen, being able to keep it frozen before you start using it for the injections. The Moderna only has to be stored at minus 13 to minus 5 degrees, which is pretty typical for healthcare agencies and has worked a lot better for us. Neither one of those vaccines, however, seem to have a good efficacy against all the new variants that are being identified. So that's something that as the new vaccines come out, they've been able to alter and look at and find out their true efficacies to the new variants. So when they deliver their information to the FDA and get approval, we'll be able to know about that. I think Glenda has a great story about how we are in the worst conditions actually being able to get those vaccines to people. Glenda, are you on?
Yes, I'm here.
Thank you.
This is an event that happened last Thursday in Seattle. It was January the 28th, and at 9 p.m. that night, in one of the facilities that was storing the vaccine, it was the Moderna vaccine. There are alarms on the freezers so that if anything malfunctions, that a notification goes out. And one of the freezers malfunctioned and quit working. And so it was noticed, and the public health department was contacted, and immediately they called the University of Washington and Swedish Medical Center in Seattle and said, we have 1,600 doses of vaccine. They must be given before 5:30 a.m. today. And so what they did is through social media, they put out the alert saying that they had this vaccine that needed to be given basically immediately. And anybody that qualified that wanted it, please show up at a couple different sites in Seattle. They started doing the nurses volunteered their time. A lot of them stayed over a shift. Some people came in from the home. They immediately put these vaccine clinics together on basically no advance notice and were able to administer the vaccines. The people brought their friends. I mean, social media is a lot of younger people use, and it was with the hope that the younger people would notify their family and friends that met in the older categories or the categories in which we were doing the vaccine immunizations right now. And it really worked. The newscast broadcasted on the 11 o'clock news that night, saying that spaces were still available. And by 12:30 a.m., all of the spaces were reserved. And so to make an unfortunate experience a positive one, they were able to report that all 1,600 doses were given out before 5:30 a.m. and it saved the vaccine. Nothing was wasted.
That is an awesome story. And there are many stories out there that we're hearing, especially with the snow we've been getting recently, of people being able to get through social media, other people in the area together so that the vaccines are not wasted. So that is great. Thank you for that story, Glenda. So now we're going to talk about the next major topic, which is the personal protective equipment, PPE. And we know that at the beginning of this COVID-19 pandemic, we didn't know much about this virus. And it seemed like CDC was changing their recommendations almost every week. It was really crazy at first to make sure that we were on top of things, to make sure that we were safely working with these patients. And the supply chains at the time were dealing with either having no PPE for us or us being able to use, or healthcare being able to use alternatives. And then we also looked at disposable versus reusable. Now, the CDC does recommend a non-sterile disposable isolation gown for use with COVID-19 patients. However, what we have to remember with PPE is the level of risk increases dependent on the patient signs and symptoms, as well as the level of care that you give to the patient. So you can see that all healthcare started to go with the major recommendations, but then as the weeks went on, we had to start adding, because we were low on, the healthcare industry was low on N95s and regular masks. Some healthcare industry went to cappers and PAPRs, the electronic respirators, until they ran out of the system as well. We added face shields along the way and also added shoe and boot covers. Now this slide shows how we started to change things when we realized that we really were running out of the regular personal protective equipment that we had on hand, and we had to look at alternatives. CDC helped us out with recommendations. The difference between their original preferred recommendation here and the alternative was N95s were not easily accessible for many healthcare industries. So they put out a acceptable alternative and said that we could use face mask as an acceptable alternative. So you can see how quickly things changed along the way. Excuse me. So now it's important to know that gowns and other apparel are intended for medical use are regulated by the FDA, highly regulated by the FDA. And along with that, the Association for Perioperative Registered Nurses, which is a society that offers comprehensive standards and guidance that includes what type of gown protection is needed for what operative procedure or other invasive procedure. And then AMI, Association for the Advancement of Medical Instrumentation, is an organization that advances the development through the safe and effective use of medical technology. And they're the ones that provide the standards for liquid barrier performance, the ratings on the different gowns, and what protection that they provide. Additionally to those two societies, we have one more that's not on this slide, which is ANSI, and they work very closely with AMI, ensuring ANSI is American National Standards Institute, and they ensure that all work continues with safeguards in place and safeguarded standards and quality guidance through all of these medical technology components. So ARN, again, they have highly regarded standards for what must provide a barrier resistant to blood and fluid penetration on the gowns, depending on its intended use. They test and make recommendations for seams and points of attachment to minimize the penetration of any body fluids or biohazardous contaminants. They ensure that these gowns are resistant to tears, punctures, abrasions, rips, everything. They're made of non-abrasive and non-toxic materials for safety for the healthcare provider. They ensure that all the gowns have the appropriate sizes and the appropriate sleeve length to prevent exposure to the healthcare provider. And then they also ensure that they're lint free, because if they're made out of lint, there's the potential that that gets into the surgical site and potentially causes an infection with the patient. AMI is the one that actually talks about and makes the recommendations for the levels of protection, what you have to look for the type of gown you need for how you're working with your patient. So the minimal fluid barrier protection is actually an AMI level 1, and it goes all the way up to AMI level 4, which is the biggest, the highest fluid protection and microbial protection. It has emphasis on critical zones. These are used for long-term cardiac events, intensive procedures, and also for patients that have bloodborne pathogens risk. And let me also say that that information is listed on every single gown that you get. So when your supply chain gets gowns in, they immediately look to ensure that it meets the needs for their facility that they're working with. Isolation versus surgical. Isolation, of course, gowns are a protective article used by medical personnel that avoids exposure to bloodborne pathogens, to blood and body fluids, any other biohazardous material. The gown is a two-way protection that prevents both exposure to the medical personnel from being infected and contaminated, and protects the patient from being protected as well. Excuse me. For the gowns, what they look at, especially an isolation gown, the medium to high risk of contamination is the highest rated gown. So you can see by the little illustration there, the exposure, the critical area zones that they look at and protect and grade after testing are A and B, which is the very front of the gown, and then the back, the bottom part of the sleeves. These are the areas that are most highly contaminated when involved with working with patient care. So isolation gowns that claim moderate to high protection would be those that you're doing heavy patient care. The patient's in isolation, they're doing heavy patient care. There's a lot of body fluid evident. They would go for the high to medium to high risk barrier gown. The low to minimal risk is used more for regular isolations, regular protection of a healthcare provider that's working with a patient. They're not worried about body fluids of any sort. These isolation gowns should not be used by the surgical teams for invasive procedures. Now, surgical gowns, they are kind of twofold as well, in the same way that they play a role as a barrier between the patient and the medical staff to reduce potential contamination, and also that the surgical gown can block any kind of dissemination or colonization of microorganisms from the healthcare provider to the patient again. For healthcare activities with low, medium, or high risk of contamination, you have to look at the procedure or the activity you're dealing with your patient to decide how much exposure is going to occur. And these gowns are intended to be worn by the healthcare personnel for surgical procedures only. The level 4 is the highest level, remember, AAMI gown for exposure. Now, disposable versus reusable. In 2020, the emergency use authorization by the FDA was published because of the possibility of healthcare beginning to run out of supply chain PPE for our healthcare providers. It very specifically still stated what the priority PPE should be for healthcare providers, but in an incident where there is none of this type of gown available, look at this type of a gown that would be approved by FDA. It was a very important document for all healthcare to be able to look at alternatives if for some reason we could not get gowns, we could not get masks, or we couldn't get N95 respirators, which we really went through a very scary time last year, actually caught in between not having supplies in many healthcare industries. Right after that, CDC developed its contingency plan in 2020. And what it really is a list of activities. It went more specific, more in depth than the emergency use authorization by the FDA did. It went specifics as to procedure, what kind of gown you should use. If you cannot get this, try this alternative. It actually gave healthcare steps to be able to put into their policies and procedures to continue to safeguard the healthcare providers while they were still dealing with supply chain activity problems. They also reminded everybody that you don't reuse them, you discard them if they are visibly soiled or damaged. And then there also was some success out there with new decontamination processes, reusing disposable PPE, with using ultraviolet or with using hydrogen peroxide. There were some successes, and then there were some failures in different areas of the country as to how they could continue to reuse disposable PPE. Therefore, we got a resurgence in reusable isolation gowns. And one comment that came out from CDC, because they were seeing a lot of products coming across the supply chain that maybe only had half the back covered, the gown was only half made in the back, or it had no coverage for the healthcare provider in the back at all. So both FDA and CDC came out and stated that that was unacceptable, that that was a safety issue for healthcare providers of allowing them to be exposed when they didn't need to be exposed. So we did have a lot of support from both the FDA and the CDC on ensuring that whatever product we could get a hold of did fit the needs of the healthcare provider. I think Glenda's going to take over and give you some really exciting information about disposable and reusable gowns. So Glenda, if you want to take it away.
Okay, thank you. Yeah, the reusable gowns have proven to be superior for an environmental perspective. They provide sufficient cost savings for the facilities that are using them. They provide superior protection and performance for the people that are wearing them. But the big drawback in preventing greater use of reusable gowns is the lack of wearer comfort that occurs during the long duration of surgical settings. It's the breathability is poor in the fabrics of these gowns, and the user that is wearing them gets too hot. When you are getting gowns evaluated and the testing for them to find out if they meet the standards that are required by the FDA for medical use, they are tested and evaluated against their resistance to water and hydrostatic pressure. The durability assets include the breaking, the tearing, and the seam strength. The piling resistance, are they the stability that they demonstrate, the air permeability, and they're evaluated for color fastness and the quality of the fabric. There was a study that was published last October of 2020 in the American Journal of Infection Control, of a study that was done on evaluating disposable and reusable gowns. They collected data on the disposable gowns were all new because they're a single-use item, and the reusable gowns that were in this test were studied after 1, 25, 50, and 75 industrial launderings. The results were compared to the AAMI PB70's performance specifications. And if you would like to know what they are very specific. All you have to do is Google AAMI PB70, and the exact website that is listed here will come up from CDC. The standard, the AAMI and ANSI PB70 standard, is a liquid barrier performance and classification for protective apparel and drapes that are intended for use in the healthcare setting. The American Society for Testing and Materials Performance requirements also, their standards were also evaluated in this particular research study. Oh, and one more comment on the research study is that as far as the results on the disposable gowns, none of the level 1 or level 2 met the AAMI standard performance for impact penetration of water resistance. And all levels of disposable gowns failed to meet the American Society for Testing and Materials performance for the breakthrough strength and cross direction. So it's a very interesting study. I will give the reference to Christy so you can have it for your information. Mask, the protection on mask is very important. It must protect your nose and your mouth. It should fully cover the nose and the mouth to prevent fluid penetration. There's a variety of masks that are available, and they are illustrated here. Some go over the ears, some go around the back of the head. Some of them have to be fit tested. Some of them may have a valve in them, but there's a whole variety that have been approved for use in the general public and also for the medical field. There's a lot of questions about what's the difference between an N95 and a KN95 mask. These are actually both types of respirators by classification. Both of them are designed to filter 95% of the particles that are entering the mask. The N95 meets the standards for approval by the American healthcare settings. They offer more protection than a surgical mask. They can filter out both large and small particles when the wearer inhales. The KN95s refer to a standard that is based in China. Now, under the emergency use category that went into effect in last year, some KN95s have actually received FDA approval for use in medical settings. However, a lot of them have failed to test out correctly. But NIOSH, who is the occupational health and safety arm of the government, has not approved any of the KN95s for use in the medical setting in the United States. And now you'll see a variety of the way people are wearing masks. There is one correct way to wear a mask, which is over the nose and the mouth, but we see them over the chin, under the chin, over the top of the head, hanging around the neck. And we need to make sure that when you wear a mask, you wear it correctly. Now there's disposable versus reusable masks and respirators. The selection type must be considered by the risk of exposure that is going to be incurred or involved. Generally, these particular respirators or masks are not reusable. However, under the contingency plans that were put into effect this last year, extended use for the face masks that have ties around the back of the neck are not approved for multiple uses, and they need to prioritize your activities. If they are soiled, damaged, or hard to breathe through, they must be discarded. Any of these must be discarded. There has been some success with the decontamination process for the N95 mask, but there is a fail rate in some of those after they have been reprocessed. And there is a specific process for storing these masks for future use. Normally, a healthcare worker would be given several masks for their own personal use, and then they would rotate them one day at a time. And when they are not in use, they would be placed in a paper bag with their name on it for storage and then reused on day 2, 3, or 4, whichever is the most appropriate. These masks also have to be fit tested in order to work correctly. So if you don't fit test an N95 mask, you may not get the proper fit. Goggles for eye protection are very important. They must fit snugly over and around your eyes. Goggles may be placed over your personal protective lenses. Personal protective glasses are not a substitute for goggles. And sometimes, especially when you're wearing the goggles and the mask, you get a fog in your goggles. And so clarity is very important, and you can get some anti-fog features in these goggles. Personal prescriptive lenses do not provide optimal eye protection and should not be used as a substitute for goggles. Face protection, there are face shields that can also be used. They protect not only the nose and the mouth, but they protect the skin around on your face and your eyes. When extra skin protection is needed, then this is the choice that can be provided. and they are used as needed for the task that is being performed. There's a variety of gloves that are available on the market. And the purpose of the gloves, there's patient care, they're used for environmental services activities, and a variety of other jobs and tasks. Materials can vary from vinyl to latex, nitrile, and a variety of other products. The important part about gloves is they should fit the user's hands comfortably. And in the illustration here, you see two types of gloves. On the left is the utility glove that is a multi-use glove and can be used for a variety of activities, including laundry services and housekeeping and environmental services cleaning. And the right-hand glove is a nitrile or a vinyl glove that can be used in patient care and healthcare. These are not as durable and as strong as the utility gloves, and they are normally a single-use glove. Now, the question that you need to ask on selecting your glove type is, do you need a sterile glove or a non-sterile glove? Sterile gloves would be used in the operating room and in surgical procedures where it is very important to keep everything sterile. Non-sterile gloves can be used for a variety of general exams and in general work areas. Do you need one pair of gloves or two pair of gloves? Are you going to use a single-use glove or a reusable glove? Limit your opportunities for touch contamination, basically to help protect yourselves and others and the environment. Hand hygiene, we're going to include a few things here, even though everybody has heard about hand hygiene for a number of years. Actually, in the 1850s, Dr. Semmelweis in Austria is the one that got the idea that hand hygiene does make a difference in protecting patients and preventing infections. And basically what you need is just some kind of soap. It does not have to be antimicrobial. Regular soap is just fine for most cases. You need some running water, some friction, and 10 seconds in time for a good hand hygiene.
20 seconds.
20 seconds, excuse me. I'm reading the numbers, but didn't say it. 20 seconds. It used to be 15 and now they've upped it to 20. The commonly missed areas when you're doing hand hygiene are illustrated in red. It's the fingertips, around the thumb, and the webs in between your fingers. So when you are doing hand hygiene, whether with soap and water or with the alcohol gel, make sure that these areas are contacted and the friction gets rubbed on them. Hand sanitizer is excellent and has been used in a number of situations. And the important part of this is you rub that over your hands and your fingers until it is dry. When it is dry, your hand hygiene has been completed with the hand sanitizer. Do not use a towel to wipe your hands off after you have applied the sanitizer application.
Okay, I'd just like to jump in here real quick about some employee safety components with hand sanitizer. We have to remember that FDA has only approved greater than or equal to 60% isopropyl alcohol. On the FDA website, they do have a list of the unapproved hand sanitizer products, and many of these contain either contaminants or a different type of alcohol. Some of them even contain methyl alcohol, which is a wood alcohol that's very, very toxic. And we recently found out that sanitizers, just about all the sanitizers coming from Mexico, have been restricted. And it's because when they were tested, all the different types were the same. And they were restricted because they were either contaminated with methanol or they had other contaminants in there. So the lesson here is that if you're buying a hand sanitizer, if the type and the percentage of the alcohol is not listed on the product, do not purchase. Purchase something that it's FDA approved greater than 60% isopropyl alcohol, and that's exactly what you're going to need to use. Okay. And also remember the herbal and all natural sanitizers, which are very, very popular. I know that. But they do not have documented efficacy, evidence of efficacy for what they are effective against. All right. So laundry, let's talk about laundry before, during, and after pandemic. Best friends. I can tell you they are best friends, at least from my perspective of working in healthcare for 42 years. I've met some wonderful, very proactive, great laundry services leaders and employees. Best friends with infection prevention control, best friends with the supply chain. If you look through the literature, you find out that the healthcare associated infections reported and documented to be linked to contaminated fabrics are really so few in number that overall disease transmission during laundering process is documented as negligible. And current control measures, including standard infection prevention, seem very effective in minimizing contaminated laundry. However, as we've probably been inferring the whole time here for this presentation, in a pandemic, all measures need to be reassessed from a team perspective for quality, safety, and employee and leadership concerns. Pandemic reminders. We want to remind people that you need to know your facility and associated partner facilities emergency preparedness plans. Are we working together during this pandemic? You need to review policies and procedures for continued safe handling of the textiles that you work with, and also the policies and procedures to continue providing a safe environment for your employees. Can't say it enough that the line of communication needs to be open, not only between your partners, but between your staff as well. Protecting the laundry, continue evaluation of PPE of all staff job responsibilities. And remember to relook at them too. If you have staff that are going from a clean to a dirty, or dirty to a clean job responsibility during the day, they need to be aware of what PPE they need to use, and be confident that it's been evaluated for that job performance and it's good for them to be able to use. Also ensure a clean and safe environment. Make sure the proper use by your staff of PPE. Check workstations constantly, the environment for safety and for communication from your staff. They're the ones that are really on the floors all the time and working with the textiles. They may see something that you have not seen yet and that you need to be aware of. Increase routine education and reminders to staff. I know that's really hard to do. Sometimes we put up a sign and then we remember that it's still there a year later. What we have to remember is how often it's looked at. And change it often, because CDC did do a study several years ago that they put up a sign, they tested employees while the sign was up about what it was about, 3 months, 6 months, and 12 months. And they found out that at the 3-month time period of review, half the people didn't even remember the sign. And certainly by the 6 months, nobody even knew it was there anymore. They had no knowledge of it, no remembrance of it. So anytime that you put signage up, because little signs there, that's great for education as well and reminders, but they need to be changed. Even if you change just the color and keep the information the same, they need to be changed constantly. And make sure, and as you guys already know, to optimize the use of all of your engineering controls and your indoor air quality, and immediately follow up for possible exposures. Immediately follow up. That's what healthcare likes too. We like to hear right away if there's been an exposure, and was it our fault? What can we do to prevent it from ever happening again? Protecting the laundry staff, actively encourage sick employees to stay home. I know that's hard to do. You know, you need your staff. It's hard when somebody stays home, but you have to remind them, because your staff probably want to come in to go to work, but you have to remind them that it's better for their health to stay home and recuperate, and it's better prevention for the other staff members that they don't get sick. Separate identified potentially ill employees from general employee population. As soon if they come to work and at noon all of a sudden they start not feeling well, they start posing, a higher temperature. That's the time that you get them out of the main staff area. You put them in a private room and assess them as to whether they need to go home or go to the doctors. And that's also the time that you remind all of your staff, to ensure good respiratory etiquette. Sneeze into your elbow, wash your hands, cover your cough, wash your hands, make sure your surroundings are clean, and wear a mask. That is everything that we can really do to ensure that we're not transmitting microorganisms back and forth to each other. Perform and routinely audit environmental cleaning and equipment products concerns. The cleaning needs to be continuously, not at the end of the day or the end of the week. You need to look at the environment on a all-day basis. And again, the open communication for forums and learning opportunities. Laundry and infection prevention. I know all of you have probably already worked with infection preventionists or with at least the healthcare industry, the hospitals. And what we need to make sure is that we have a good communication back and forth, a good communication relationship. I know that the last facility I worked at, we had a great communication. In fact, I worked there most of my career. We always had a great communication, able to speak to each other, to report concerns, to address employee concerns. That's the kind of communication plan that you need with your infection preventionist. And local infection preventionists, believe it or not, like to and can assist with answering any employee questions that perhaps you get that maybe the employee just isn't understanding the answer. Ask infection prevention and control to try to talk it out with your employee. Also, they love performing educational opportunities. And you know what? It's nice to see a different face every once in a while. Sometimes it irritates me because I'll bring somebody else in to do a presentation. They'll say something and everybody in the room will go, I didn't know that. And I'm thinking, I just told you that last week at that presentation. So it can be a little bit irritating, but if it gets the point through, that's the whole idea about it. And infection prevention can also help your facility with risk assessments, both for safety, employee job responsibilities, new processes you bring in. The infection preventionists at the hospitals are experts at risk assessments. And those risk assessments can really help you moving forward as to whether is this new process we're bringing in good for us or not good for us. Is this new equipment that we have here, is it really safe equipment that we need, or the environment? They're very good at risk assessments. And then the other really neat thing, which I hope is done across both Canada and the United States, is supporting infection preventionists will support quarterly or semi-annual regional partnership meetings. They'll be there with you. They'll answer questions. They can do audits for you at the end of the meeting, walk through your facility and look at cleanliness, look at PPE, look at the whole environment and give you some suggestions. They can help you audit before your annual survey comes in. I know it's a little tenuous right now because the infection preventionists are being pulled here, there, and everywhere. But in a typical situation, you should be able to use your infection preventionist for all of these supportive actions. And even right now, you can use, if the infection preventionist from your local hospital that you work with or your local facility that you work with isn't available, there are constantly listings of retired or consult infection preventionists that can step in as well. Oh, we went a lot faster than I thought we would. We did good. So you can see here at the end for the references, we made sure that you would have not only the short name of whatever we were area that we were dealing with, but their official lengthy name as well as their website name, so that you could go back to your notes and go, wait a minute, I didn't really understand the levels of ARN in the depth that I want to. So you can go to the Association of Perioperative Registered Nurses and look at what they have listed there to help you learn more about the different levels. Because I know we defined them today, but we really didn't go into detail, but maybe that's what some of the questions will be about. Also, and that's where we are. We are at questions, and we would love to open up the forum for any questions that you have for Glenda or myself or Christy, or any discussion.
The first question I have for you is there any area in particular in the laundry that you would suggest operators review in light of COVID?
Yes. Oh, yes. I am always greatly concerned about the sorting area, the soiled area and the sorting area. When I do audits, I try to spend a lot of time there, whether there's personnel there working right then or not. I feel they are at the highest risk because they have the laundry coming in from, the physician's office or the hospital or the clinic, and they're the ones responsible for sorting. And sometimes you go in there and sometimes it's very, very hot. I know that. You go in there and you just have, people wearing gloves or not wearing anything at all. And that's when I pull the leadership aside and tell them, okay, first of all, it needs to be cleaned up there for their safety, but we need to go over what they have to use in this area. It is a high risk area. And this is really where the majority of the exposures occur if there's a bloody washcloth or a needle or whatever the case may be that gets through to the laundry services. They are the highest risk people. So I'm always greatly concerned about them. And I always make sure that either myself or somebody gets in there on a periodic basis to make sure those areas are following the protocol that they're supposed to follow for their own safety.
I have a question posed to the group. And if anyone wants to, you can turn your mics back on if you want to respond. Has anyone had experience with or thinking of implementing the use of electrostatic spraying, fogging equipment to provide for disinfecting your work environment?
That's a great question. I would love to hear if anybody's using that out there. There is research behind it. It is easy. There's many types of those products out there, and they are fairly easy to use. I think you really have to investigate the company to ensure that they're meeting the regulated standards to be able to supply you with a good product. I think I'm a little bit old fashioned, and I think, and that probably reflects the 42 years in healthcare, how old I am, but I love physical scrubbing and cleaning, whether it's your environment or whether it's your hands. That's the way that you're going to ensure that you're doing a really great job. But I see the papers that are out there that are using the electrostatic as well as some other new technology out there as a follow-up to regular cleaning to ensure that they've caught everything.
We use the electrostatic sprayers with the disinfectant after everything's cleaned. We added another one to help just move through the spaces faster, since we increased the amount of disinfection that we've been doing since COVID. So in order to speed the process up, we've added a few of those. So high touch surfaces like doorknobs and light switches and things like that. So yeah, we use them. They're used every day, several times a day in our plant on the high touch surfaces. And so far we feel like it gives us an opportunity to disinfect multiple times a day on those high touch surfaces, and it does make it a lot easier and faster, Colin. So I'm happy to share the information on the ones that we use. If you want, I can send you an email and get that information to you.
And that's pretty awesome, especially when you said, you use it in addition
Yeah.
to regular cleaning. That's the perfect way of using it. So that's great.
Yeah, the important thing to remember is if there's gross contamination, it must be physically cleaned before a lot of these other products will work. You can
Very
spray
true.
over dirt, but it's not going to take care of what's underneath it. So you need to make sure that the gross contamination has been physically cleaned first before some of these other practices are implemented.
What we've did here is we purchased a couple of portable fogger that we're using in common area like lunchroom, locker room, places like that. In the plant, every station has solution and rags to be cleaned physically at every workstation. And then we purchased an ultraviolet machine to do the inside of the trucks.
Awesome.
So yes,
We found that, sorry, we found that the issue with technology like electrostatic sprayers is that unless people are specifically trained in actually cleaning and disinfecting a surface, that's what they do on a regular basis, that what typically happens in our experience is that people who begin to rely on things like the electrostatic sprayer or other technology, and they stop or reduce their actual cleaning effectiveness is significantly reduced because they become reliant on what they think is going to actually fix the problem for them when it doesn't actually do that. That was one of the biggest things. So if somebody, my advice to anybody using electrostatic sprayers is be sure to regularly test the surfaces that your staff have cleaned prior to electrostatic spraying and actually ensure that they're doing the job well, because in healthcare, that's huge. It's massive. I do both environmental services for healthcare and also laundry for healthcare. And like I said, what we found here is that people start to become, I'm not going to say lazy, but they start to not, if they aren't trained properly, they don't necessarily realize that you still have to clean. This is an additional step in addition to cleaning. It's not replacing cleaning and disinfecting.
Good point. And that goes with the education, as you said, of all of your staff to make sure that they understand that point.
Well, here in Quebec, our let's say our OSHA regulatory commission actually asked us to write a new cleaning procedure to actually tell people to take the bottle, spray the area, take their rag, wipe it until it's dry. Even though you would think everybody knows how to clean, they actually forced us to rewrite a cleaning procedure and train everybody.
And I like that because think of how many people say they know how to wash their hands and then you see them walking right out of a bathroom, not washing their hands or just flushing, squishing the water around. And I think that's a great idea, as well as visual signs. If you put little visual signs up here and there, change the colors, but the point is still the same, people are going to remember those things. Great answers, great discussion. Thank you.
Well, if we have no more questions, I'm going to thank Glenda and Jackie for everything today. On behalf of all the IATM members, you put a lot of work and information into this presentation, and we really appreciate it. I also want to thank everyone that joined us today for making these sessions successful. So if you have any follow-up questions or suggestions for other sessions, please send me an email, and I hope everyone has a great rest of the day.
Thank you all very, very much. This has been fun.
Right. Thank you for inviting us to participate with your group. It was a pleasure to be able to visit with you.
Thank you, everyone.
Bye-bye.
Bye.
Thank you, Christy, too.
I'll
Yeah.
talking to you both. Thanks again. Bye-bye.
Bye.